Hello, I'm Dr. David Durst. I'm a plastic surgeon here in Huntsville, and today we have produced a very small video in our office about silicone implants. We hope you find this information interesting and possibly helpful in your consideration of the type of breast implant that you might want. One of the things, though, that people are sometimes worried about is what would happen if an implant developed a leak. And for that reason, I want to show you today what happens with these new silicone implants if we were to lose the normal consistency of the outer envelope, which is silicone. This is an outer silicone plastic, but the inside is also the silicone gel. The old implants from the 80s, the silicone was really pretty much like a liquid, almost like liquid Crisco. And when they would get a leak, it was really pretty messy inside the body. Scar tissue would form around the silicone, but it would be a little bit difficult to remove. In the 1990s, a new type of gel was invented, which is quite a bit more structurally durable, such that the gel sticks together and is almost like pudding or jello. And as a result, probably the easiest way to see that is to take one of these implants and cut it in half and see what it looks like. In reality, we're working without a net here. As they say in the circus, I've got carpet here and my nice chair, so I'm confident that we're not going to have a big problem. We'll just go ahead and cut this in half. I think you can see that although the gel kind of moves back and forth, it really kind of stays put and just sits in the actual implant itself. It doesn't really drip out. And that means that even with a leak, it would not be the kind of thing that would be a great deal of difficulty to correct later on. If an implant does leak, it does require replacement, but nonetheless, it's not nearly as complicated as it used to be. This just really doesn't even want to come out of there. I hope this helps with your understanding of the modern silicone implants. We like to utilize the silicone implants. They have a more natural feel than the saline implants do in many situations. Cosmetically, the results are otherwise very similar, but I think ultimately the silicone is going to become the more dominant implant again, and it has already replaced saline implants as the most common implant in my practice. I'm utilizing mostly silicone implants, probably at least 80% of the time now.